Hi, I'm Dr. Mark Kovacs. We're going to be talking about tennis elbow. As we all know, tennis elbow is one of those conditions that can be debilitating and can really put a hindrance on activities of daily life as well as playing tennis. We're really going to get into the details about what tennis elbow is, what are some of the causes, and then specifically what are some strategies that you can do to help reduce, if you do get any pain, how can we reduce that pain, and then what type of exercises can we do to strengthen it so that you don't have tennis elbow in the future. So as we go through, we'll do a series of different progressions. We'll first really understand the background of where tennis elbow occurs, what some of the terms are that you may hear discussed, what are some normal treatments that may be recommended, and then we'll go into a series of progressions of exercises that you can do at home with very little equipment that can really help strengthen the muscles around the elbow, and then also ways that we can ensure that if you don't have any problems at the moment, that if you do these exercises, that can help stave off any potential problems you may have in the future. So as we look on the screen, we're going to go through some series of anatomy of the elbow, because it's really important as we have a look here that the elbow itself is made up of a series of bones and also muscles. Realize that the elbow is in between the wrist and the shoulder. So a lot of problems that we see at the elbow are a result of weaknesses or poor technique that we may have in our tennis strokes or in our activities of daily living. So from a standpoint of understanding it, most problems that we see at the elbow aren't necessarily just an elbow problem. It may be a result of weaknesses around the wrist. It may be a result of poor posture, meaning that our shoulder girdle, our scapula, or the muscles of our upper back aren't doing the job that they're supposed to do, which puts added pressure on the elbow itself. So really getting a good sense of where the problems are arising from, and then understanding how we can do little things that may make a big difference in overcoming any problems you may have. So first off, we really want to understand that tennis elbow as a condition is usually a result of a couple different things. It's a result of poor technique from a sports standpoint. So most recreational tennis players, for example, may struggle from tennis elbow. It's interesting to note that nearly all high-level tennis players actually rarely, if ever, have any problems with that side of the elbow. So just to clarify, tennis elbow means we have pain on this outside or lateral side of the elbow. You may also experience some pain sometimes on the inside of the elbow, which is called golfer's elbow. It used to be called a lateral epicondylitis, or the lateral side of the elbow. Over the last few years, due to better understanding of the etiology of the issue, it's changed to tendinopathy more so than tendinitis. So we want to understand that there is an inflammation there of the tendon in a true clinical diagnosis. However, a lot of people get some pain around the elbow that may be mild all the way to severe. So understanding that when it occurs, why does it occur? So from a stroke standpoint, sometimes that when we do this motion, which is known as pronation, if we do an excessive pronated motion, we may stress the muscles around the elbow. Sometimes if we make contact, say on a backhand with the ball that's late for a right-hander, and we lead with the elbow and then we forcefully extend out and violently extend out and then make impact, that can put pressure on the elbow as well. So if you are struggling with some pain from tennis elbow, take a look at your technique, speak to your teaching professional, see if there's something you can do to help improve your technique, because it's something that really definitely is a result many times of poor technique. If it's not poor technique, or even if it is, there's usually also a weakness there as well. So that's where we're going to spend most of our time discussing treatment strategies, plans, how do we stretch appropriately, how do we strengthen appropriately to ensure that we take care of the muscles around the elbow. And these are some evidence-based information that has come from the research and has shown to be very successful in the treatment of tennis elbow. For example here, if we're looking on the screen, we have a few different muscles that we want to understand. We have the extensor muscles, which are these muscles right here. And that's an area that we want to make sure that we understand what extension occurs and flexion occurs. So that we're going to talk through that as we get into some of our exercises. If we take a look at the next slide here, we're actually looking at an x-ray here, and we can see the bones around the elbow, and then most of our problems occur somewhere in here, in this area right in there. And that's pretty important to know, that we know where the pain exists. What we want to understand is what are some of the potential treatments that can occur. So if we have a look here, this would be our plan of action. So from a standpoint of understanding when you first potentially may get some initial pain, there are some things that you can do initially. One of the best things to do is rest. Rest initially, again, not in the long term, but in the short term, is to avoid the series of pain stimuli. So what's causing the pain? If it's opening a doorknob, if it's hitting a certain stroke, avoid that situation so that you don't get that pain stimulus immediately. So as we can see here, rest first, and that's just avoidance really of what's causing the problem. Then we have possible immediate treatments, which is like icing the area, which can be done using ice cubes. It can be done using ice cups, which allows you to just rub slowly over the area. And again, this is a short-term treatment just to reduce the pain initially. So it's an analgesic response. It somewhat numbs the area, and it's a relatively easy thing to do that can help relieve some of that initial pain that you may have, or that sensation that you may have. Then you may want to get into some self-massage techniques. So there are different forms of self-massage techniques. Some you can use implements, others you can use your hand. So one of the ways that we utilize it quite consistently is we just get our knuckles and we slowly rub on the area to try to relieve some of those trigger points or tight spots that we may have right in that area. And that is one strategy that works rather well. Can also use one of our implements here. So this is called a massage stick. TheraBand makes it. It's very easy to implement. You can just rest it on your leg and then you slowly roll up and down. So like this, we can work through that and we can shift the angle to try to loosen up any tight spots, because typically you'll get quite tight through here. Loosening up both on the lateral side is useful, but also on the medial side or on the underneath side. If we can loosen all that area up, only by a couple minutes, just really loosen that up very simply. Very good strategy that can be quite effective. The other thing you can use this for is also to dig in from a trigger point standpoint. So you find your tight spots and you actually slowly put pressure on the area and just move it around slightly. This allows you to really dig into some of those tight knotted spots that you may feel. Again, really good tool, something that can be utilized pretty consistently. Then if we have a look at the screen again, we look at within a few days, then we can really go into start heating it up. By heating it up, we get blood flow to the area. That's a real positive step, can get good blood going to the area. Another good strategy is using electrical muscle stimulation. So I use the Mark Pro device, which provides an electrical muscle stimulation to gently contract and relax the muscle. That gentle contraction and relaxation is really effective because what it does is that it brings in good oxygenated blood to an area, and it can help remove deoxygenated blood. And our objective is to get as much good oxygenated blood to the area to help with that recovery and repair process. Then we go into a series of stretches, appropriate stretches that we will highlight as we go along here with our different progressions of stretches. And then the third piece is more advanced self-massage techniques that we can implement as well. So again, it builds on those first couple days when you do have significant pain. We want to let that pain subside somewhat, and then we implement our stretches and our strengthening program. Once we get to within a week or two, then we really start having to get a structured strengthening and stretching program. And this is really, really important because you still may have some mild pain, but you're at a point now where you can actually develop some strength through the area, make sure that we understand the right strengthening exercises to do, and then also a structured stretching program. This is really, really important, not only for the individuals that are struggling from the pain, but this is for anyone that uses their arms pretty significantly, whether it is playing tennis or whether it's doing other activities that may be stressing that lateral side of the elbow. But we want to make sure that you have the right strengthening program, the right stretching program to improve the muscle function and then also develop muscular endurance in that area appropriately. So as you can see, we're creating an action plan that you can implement. One, if you do experience some pain from tennis elbow, but also we go straight to our within a week or two program for anyone that's trying to offset that or try to prevent tennis elbow from coming in the future.